Hey everyone, Dr. Hanisha here. Thank you so much for joining me on my podcast, Mahan Health with Dr. Hanisha. Mahan literally translates to great in Sanskrit, and it just doesn't make sense to have anything but the absolute best when it comes to your health. My goal is by you listening or watching this podcast, you're getting just a little bit closer to achieving Mahan or great health yourself. This podcast is all for you, so please make sure to comment what you'd like to learn more about so I can get a guest on the show who's an expert in that field, or I might even talk about it myself. I am now seeing patients and clients all over the world virtually, so make sure to book your free 15-minute phone call today to see how you can start achieving Mahan or great health yourself. I also want to mention that if you are in a state where naturopathic medicine is not currently licensed and you've experienced any benefits from holistic, naturopathic, or functional medicine doctors, or this podcast in general, be sure to look out for call to actions. In the state of Ohio, we're currently working on pushing emergency licensure so we can support our MD and DO colleagues in reducing the overwhelm of the healthcare system. NDs are actually trained comparably to conventional doctors to diagnose and triage according to presenting symptoms, refer to the appropriate level of care, and support patients during at-home symptom management. NDs practice patient-centered medicine and tailor personalized care plans. In addition to all the public health recommendations, NDs also employ a toolkit of treatment approaches that can be used to support the body's inherent immune capacity to prevent viral infections, address viral infections directly, ease symptoms in those infected, and support recovery during post-infection care. This will significantly increase access to care. By licensing NDs, we can have doctors who can practice in the states that have declared a state of emergency and are now calling for volunteer healthcare practitioners to prevent the healthcare systems from being overwhelmed. So right now, the healthcare system is extremely overwhelmed with the number of patients who are experiencing or who have COVID. And so by licensing naturopathic doctors, we can help reduce that overwhelm and potentially help in reducing recovery times as well. And so with all that said, please make sure to follow my social media pages for how you can support all of these endeavors. We will be putting out a call to action hopefully soon. We did take a different route from what was originally planned, so just stay tuned for that if there is a call to action for you also. Thank you so much. Your support is always appreciated, and we hope that we can always do what we can to support you and serve you as well. All right, getting into today's episode. Today, I had the opportunity to interview a friend and colleague of mine, Dr. Hiten Patel. Dr. Hiten Patel grew up in Perrysburg, Ohio, to a family who immigrated to the U.S. from India. He completed his undergraduate studies in Biomedical Engineering at The Ohio State University and medical school at the University of Toledo. He is currently the chief resident in family medicine at Ohio State. He is also working on completing his MPH at Ohio State as well. He will complete a fellowship in clinical ultrasound this upcoming year at The Ohio State University as well. After completing his training, he plans on practicing broad-spectrum family medicine, including providing care in the office, urgent care, and the inpatient setting. His professional interests include preventative medicine, chronic medical conditions, evidence-based medicine, medical education, and point-of-care ultrasound. In his personal life, he enjoys biking, traveling, playing tennis, cooking, Zooming with his family, and playing with his whoodle puppy, Toby. Dr. Hiten Patel is one of the most genuine and smartest people I have personally ever met. We actually met in undergrad at The Ohio State University, our freshman year of college, and I'm so grateful for all of his help getting me through physiology and OChem, which of course then helped me get to where I am today. So I'm incredibly grateful for Hiten. And it's been so wonderful to see him become this extremely compassionate, empathetic, and adept doctor that he has become, and it's extremely fulfilling for me to see. So I'm really excited for you all to get into this episode because we talk a lot about the misinformation that's out there. There's so much information out there, and some of it is legitimate, and unfortunately most of it is not. And so we talk about how that could be dangerous to our health and what more reliable sources can be and how to find sources that are more reliable. And Dr. Hiten Patel, I saw he actually did a live video for the Ohio State Wexner Medical Center on this topic, and this is why I wanted to reach out to him to talk to him about this specifically. He's actually the first medical doctor that I'm having on the podcast, so I'm really excited to have him be a part of this integrative medicine. We do talk about how important collaborative care is, and I'm grateful to call him my friend and colleague. Okay, well, let's move on to the show. Make sure to leave comments below on what you thought of this episode and reach out to Dr. Patel or myself after the show. All right, enjoy. Hi, Dr. Hiten Patel. How are you doing today?
I'm doing well. How are you doing?
Doing well. Thank you so much for joining me on my show today. I really appreciate having you.
Not a problem. Excited to be here.
Yeah, I was just telling you this, you're actually the first medical doctor I'm having on the show. And so I'm really grateful that you said yes to being on the show.
Yeah, like you were saying, I think, within the climate that we're in now and really all the time in medicine, collaboration is really important. And, we can all learn something from not only other healthcare providers, but, all patients, everyone. So I'm excited for this opportunity to talk with you about kind of what your experience is and kind of what my experience is with what's going on right now.
Yeah, definitely. I mean, yeah, like you said, that is so important, that collaboration. So let's get right into the interview. Tell us a little bit about yourself and what drew you to medicine and, in particular, family medicine.
Yeah. So I listened to this podcast and they start out with like one-liners. So I'll start off with like a one-liner of who I am. So I'm a 29-year-old family medicine doctor in Columbus, Ohio. He's a son, a partner, and a dog dad who, in his spare time, likes to cook, bake, and go on bike rides. So that's a little bit about myself, not including the medicine side.
Yes, I love it.
But my parents, so just kind of a brief background, my parents immigrated from India in the 80s, and they grew up in Perrysburg, Ohio, and then went on actually went to Ohio State for undergrad, and that's where we met,
Mhm.
and went on to go to medical school in Toledo. And so right now I'm a family medicine resident at Ohio State in my third year. And also doing my MPH at Ohio State as well, finishing up with that. So in the future, kind of my goals are to practice kind of full spectrum family medicine, being in the office and urgent care clinics and in the inpatient setting. So that's a little bit about myself, but just kind of some background of why I chose medicine. I think in undergrad, I was really interested in helping people, but I didn't know what the best outlet for that was. I think it's now that we're talking about essential and non-essential workers with COVID going on, we're realizing that like everyone's essential, right? And so every person in their own job can help someone. And back then, I really wanted to do engineering, and so my thought was I can work on a device and develop a device and really change the scope of people's lives. But then I soon realized that I needed that interaction with other human beings, and I really enjoyed, especially when talking with my family about things, questions that they had. I really enjoyed providing advice and then seeing them benefit, and then kind of me getting gratification from that, and then being more motivated to help other people. And so that kind of led me to medicine. And then family medicine was a really challenging choice for me. I actually was going into third year of medical school thinking I wanted to do child neurology, which is the total opposite of family
Yeah,
medicine. It's like super
very different.
subspecialized. Exactly. And so, and that was because I was fascinated with the brain and I was really interested in changing the life of kids, because if you can change the course of life from the beginning, and then, you set up a great life for adults. But then I went into my family medicine rotation, and I really saw the breadth and kind of the scope of what they can do. So taking care of pregnant women, taking care of older patients, seeing people who are healthy, seeing cardiac conditions, seeing mental health, and kind of being that jack of all trades. I get bored really easily if I do the same thing over and over again, and family medicine gave me that opportunity to do really anything, walking into any clinical setting in a hospital, delivering a baby, and I've enjoyed it. There's been a couple days throughout my residency where I, you know, in the middle of the night go deliver a baby. The next morning I go see the baby in the morning, and then I go to clinic during the day, and then I go back and see the baby and do a circumcision, something like that. And so that just, it's really gratifying to be able to care for anyone and at any time.
Yeah, that's really cool. I actually have a similar story in terms of how I get bored really easily too. So it was always hard for me to find a specialty, which a lot of people always recommended. And I was like, I like working with everyone of all different backgrounds. And so very similar story for myself too. So that's really cool.
Yeah,
Um,
yeah, and it's not for everyone, right? So,
it's not,
yeah.
no, no, definitely not. Okay, so thank you for sharing that. All right, so let's get into the meat of the topic today. I want to talk a lot about misinformation because right now we're in a world where there's information everywhere. Some of it's legitimate, some of it's not, and it's really hard to break it down. And so let's talk about what that has looked like in this current crisis in terms of COVID-19. What does that look like, and how can that be actually detrimental to someone's health?
Yeah, I think misinformation isn't new. We've had it for decades, and clearly the election cycles show us that's been present. But I think in times of crisis, um, misinformation spreads rapidly. I don't know the exact cause. Is it people's fears and anxieties, or is it the fact that this is an easy time to manipulate people? It's hard to say what the exact cause is, but I think right now more than ever, it's important to know that our information that we're getting is accurate and not false. And so, a couple examples where I think that this is important. One, and we'll talk a lot about treatments today, but one is about NSAIDs, and there's been a lot of kind of back and forth on whether or not NSAIDs or ibuprofen is harmful in COVID. And this really started with a paper in the Lancet journal that recommended that there should be more research on NSAIDs because that there's a theoretical risk that there's a biochemical reaction leading to worsening outcomes in COVID. They didn't say that it should be avoided, but they just recommended more study. And this was eventually picked up by multiple outlets, including the French health minister, who actually eventually tweeted out that NSAIDs should be avoided. And then this spread really, really quickly all the way up to the World Health Organization, who recommended on one day that they should patients should avoid NSAIDs, and then the next day they retracted that statement. And so the challenge isn't always information that comes from smaller resources or people like publishing things or writing things that they believe in, but it's also coming from more reputable resources, because there's just so much information to sift through that unless you're looking at the data yourself and talking about that, if you're referring to another article, it's so hard to know if it's true or not unless you go directly to the data.
Okay. Yeah, and so in terms of the NSAIDs, so NSAIDs, for those listening who may not know what they are, it's like things like ibuprofen or Advil, naproxen, aspirin, all of those are NSAIDs. And so that's what we're talking about here. But in terms of those, what is what what was the basis, and right now what are they, what is the research actually showing about NSAIDs? And I know that, like you said, it's just rapidly, we're getting research so quickly from China, from Italy, from other countries that are really trying to put this together to support the rest of the world, which I'm really grateful for. But it's hard to sift through all of that so quickly, because usually research works really slowly,
Yeah,
really slowly. Yeah.
absolutely.
Yeah. So what's kind of I guess, the most up-to-date research that you know of for NSAIDs?
In COVID specifically.
Yes, in COVID specifically.
So just to take a step back, that Lancet article was kind of a discussion, like we should do more research. That didn't actually have enough research. In terms of actual articles, I think there was, and I don't know the exact reference, there was one article that had actually had NSAIDs as an outcome, and there was no appreciable difference between the two groups. Um, there's a lot of data coming out of China and Italy that I haven't sifted through, and I'm not sure if there's more information within that. There are real risks with NSAIDs in general, right? So it doesn't matter if you're taking it for COVID or not. There's a risk of ulcers, there's a risk of renal failure. There's also risks of worsening heart disease if someone has heart disease, as opposed to Tylenol or acetaminophen, which doesn't have those risks. And then kind of the theoretical background of why it makes COVID patients worse. So when someone has COVID, um, they usually get sick for about 4 to 7 days, and then about day 7 or 8, their lungs start getting essentially attacked by themselves. Fluid builds up, and they go into a state called acute respiratory distress syndrome, or ARDS. And it's thought that there's an inflammatory kind of cytokine rush, meaning there's just kind of your body's kind of trying to fight the infection, and it starts attacking itself in a way. And so the thought is that NSAIDs could lower that threshold of attack. And so there is a good theoretical basis for that, but just not enough data that I've seen myself or sifted through.
Right. And for that specifically, would you think that it would be okay if people just chose to take acetaminophen instead of NSAIDs if they were feeling sick or in pain or something like that?
Yeah, totally. I mean, there's not a reason not to take
Okay. Yeah.
Tylenol, and maybe we could talk about a little bit about it, but the fevers are actually beneficial to fight infection in general. So it's okay not to take anything as well.
Yeah. Yeah. I appreciate you saying that, because I was just about to say too, there are other things, especially naturopathic medicine, where we can support your immune system. And we usually recommend just riding out the fever and resting and hydrating, and then maybe some herbal support too, to support your immune system versus shutting it down, which is what the medications normally do.
Yeah. And usually the way we recommend, at least that I would, to take ibuprofen or Tylenol would be if you're having aches or you're feeling miserable and you can't get up and do anything, give it a trial. If Tylenol doesn't work for you or acetaminophen doesn't work for you, I don't see a reason at this point why not to try ibuprofen. But again, if you're a relatively healthy person, at baseline, you're doing all the right things, then trying ibuprofen is the end of the world.
Yeah, definitely. And I think it's also important, like whenever you say you're a relatively healthy person, I think that's also important to note too, because if you have other chronic issues, those need to be addressed in other ways anyway. So if you have high cholesterol or diabetes or something like that, we need to address that at the root of it too, instead of just trying to suppress those symptoms with the medication anyway.
Absolutely. Yeah. I think what you're referring to is just preventative medicine in general, right?
Yeah.
Medicine's turned into this industry of just, putting a Band-Aid on top, taking a medicine. There's like lots of cartoons that are out there that show like people eating steak and then they have their statin, within it. So I totally agree with you on that, we shouldn't be treating just the symptom. We should be treating the root cause of that.
Right. Yeah, and there definitely is a time and a place for symptom management, of course, right? But also addressing the root of the issues. Okay, so what do you have any other examples of misinformation that that you can think of that have been kind of more harmful to our society?
Yeah. So one other one that I've talked about before is hydroxychloroquine. And for those of you who don't know, hydroxychloroquine is a drug that's used to treat autoimmune conditions such as lupus or rheumatoid arthritis. And then there's a similar drug called chloroquine, which is actually used to treat malaria. And there was some kind of recommendations and guidelines coming out of China over the last couple months that they're using that drug along with the azithromycin, which is a common antibiotic, like a Z-Pak that people get. So there's a lot of kind of non-randomized information coming out of China that people were using that. And then there's like 2 studies from Italy, which are very highly biased. So one was about 40 patients. It was not randomized, and I don't want to get too much into the nitty gritty, but what I will say is one of the trials didn't really measure any outcomes. It just kind of measured if the virus is present in the nose. And then the other trial was about 80 patients, and that measured a little bit more of the outcomes of how patients did. But that second trial, about 15% of people required oxygen, which is very low, and 15% of people had fevers. And so that just says that these people were very mild cases. And really what we're worried about with COVID is the more severe cases, right? That's what we need
Right.
to treat. And so both of those trials were published. Of course, we're all looking for, treatments. We're all looking for cures. And so this information was spread kind of rapidly through governments and through news outlets, as a wonder drug, as something that will cure COVID. And it got picked up throughout. And there's two dangers to this, and potentially more, but two that I'm going to highlight. One is that people who can prescribe medicines to themselves started self-prescribing these drugs to themselves, leading to a shortage of the drugs potentially. And some state pharmacy boards actually prohibited and created emergency amendments for physicians and providers to stop self-prescribing these, only to be prescribed for COVID. And then two, there was, of course, that study or that report from Arizona that a couple took chloroquine from a fish tank cleaner, and the husband actually died from that. And so, the issue with that is we can misinform our public and our patients, and then they can consume something that's not approved or not, without side effects. And so that's a big example to me. I'm very hopeful that chloroquine works, just like a lot of other things, and we're actually using it in the hospital. But again, we just need to be cautious with the data that we're using.
Right. Just like any prescription drug, in the end, I feel like it comes down to that similar story of like, you don't want to just be taking prescription drugs unless they're prescribed to you, because there's a reason why they're not over the counter. And I think that's, that's crazy that it's affected people. I know that even in other countries where they don't have as many regulations around pharmaceuticals, people are just accessing it too. So I'm grateful that we at least have a little bit more regulation around that.
Yeah.
But it is scary, but it can be really therapeutic if used adequately, or potentially. We're still trying to figure it out, right?
Right. And it needs to be used on the right patients, like you said, right? So should someone who's, has COVID, they're at home, they're doing fine, be using this? I would say at this point, no, because if everyone who has COVID uses it, then there's going to be a shortage for the people who are in the ICU who actually need it, right? And so stories like this can exacerbate that.
Yeah, definitely.
Another example that's kind of coming out, which I think is very interesting, and again, this is something that's not fully data proofed, is that China's, the Bloomberg just posted this, and then I think New York Times picked it up, and so did a lot of other big outlets like Time, that China's coronavirus case numbers are actually fabricated, and that intuitively makes sense. I'm not trying to make it political at all, but just from the standpoint that if we are using our predictive models for when we'll peak in terms of our infections, what resources we'll need, et cetera, based on the number of cases that happened in China, if we're modeling based on that, which if it is misinformation, then we're not preparing appropriately, or our models could be off a little bit. And so that's really dangerous, right? If that's true.
Can you explain that a little bit more? I'm not sure I fully understand. So if they're fabricating their numbers in a way that there's less cases than they actually are reporting, is that the idea?
Correct. Okay. Less cases, less deaths, and then perhaps the breakdown of who gets sick, right? So right now we don't think kids are getting sick, and none of the data here and in Italy kind of point to that. But if that is the case, and or pregnant patients, for example, are we focusing our guidelines based on the data that's coming out of China, that's being published in these large, thousands of patients journal articles? Are we focusing based on that when that may or may not be true? Same thing with the azithromycin, hydroxychloroquine, and that just kind of brings into question a whole lot of other things. So I'm not saying that that's true, but that's something that we'll have to consider now.
Definitely. And is there a way to really confirm that?
So apparently the CIA has classified reports that they've been briefing. That's what these articles are saying. So I don't know if there's truly a way to confirm it until this is all over.
Okay. Yeah, that's really unfortunate. Yeah, because I would hope that the information, at least that the doctors in China are putting in, are accurate and reliable. But again, considering political climate in China versus here. Yeah, like, I mean, we really don't know, and it's hard to tell, and that does get very complex.
Yeah, and that's part of this whole issue with misinformation, right? Is the politics that are intertwined within it. Briefly, I'll just say that I think here in Ohio, where we both live, our governor has done a fantastic job of shutting things down right away. And their whole idea was, let's not be Philadelphia from the 1918 flu pandemic. Let's be St. Louis, who shut things down early, and they flattened their curve so much more compared to other places. And so that also has an impact. And these decisions are made based on the information that they're getting, right? And so
Right. Yeah, it's based on the information, and then unfortunately with the politics too. Yeah, I mean, healthcare in general has always been intertwined with politics, and right now the situation is no different. So, which, like you said, I think Mike DeWine, the governor of Ohio, and Dr. Amy Acton have been doing a great job. So can you actually go into, I guess, more reliable sources and like where people can make sure that they're getting the most reliable information?
yeah, and these are personal to me. I will say that I have a slight left-leaning bias, so I'll preface with that. I tend to be towards the center, but my number one resource for national news is npr.org, for two reasons. I think they're very minimally biased. They don't publish things unless they have good amount of, you know, information to back it up. But also, it's a good audio way to listen to the news, which when I'm running or outside or doing something else, it's a good, easy way to do that. In terms of larger kind of newspaper resources, I like the New York Times, the Washington Post, and then because they tend to kind of cover a broad range of topics. And then slightly for more perspective pieces, these two tend to be a little bit more left-leaning, but the Atlantic has really, really long articles, but they do a good job at breaking down topics and actually talking to experts in each of the fields. And then Vox, VOX, not Fox, VOX is a good resource where they kind of break it down in a way that anyone can understand. You know, I am not great at economics, and that's one of the reasons why I realized it, but they do a really good job at simplifying things, putting things into charts, into visual graphics. And so if you don't have a ton of time to read things, you can scroll through and kind of get an idea of if you want to look into it a little bit longer.
Yeah.
And then those are kind of my national news sources, but I think for the latest information, I definitely recommend going to the CDC website, the World Health Organization website, and those are your like number one things. And then Twitter tends to be where I get a lot of my kind of like initial information. I follow a lot of experts or kind of people who are verified, and see what they kind of retweet and the articles that they retweet on all of these resources. It's not always reliable, but it's a good starting point if you want to have a varied kind of audience that you're getting information from.
Yeah, definitely. And I do want to mention that I really do like Vox's graphics. I'm definitely a visual learner, so seeing the pictures like that is really helpful for me.
Yeah.
Yeah. But the other thing that I wanted to mention about the more reliable resources, well, okay, this isn't necessarily about the resources itself. I think what you mentioned was really helpful for getting more reliable information. But I actually just recently put out a blog post on staying sane while staying informed. And I think that's also important to also maintain boundaries around how much information you consume, because it can be very overwhelming and stressful and anxiety provoking. And so I definitely recommend still like trying to chunk up when you take that information in. Another thing that I mentioned in my blog post is like when you obtain that information, like for example, when President Trump said that we will be in this stay home order or whatever until April 30th. And then DeWine said the 30th as well too, or May 1st. I forget what day he said, but like taking that information in, being like, okay, processing it. How do I feel about this? Allowing myself to take that in instead of like avoiding it and trying to like just consume more and more information and then overwhelming yourself. And so anytime there's more news updates or information, I always recommend just like allowing yourself to process it and then like taking a deep breath and being like, okay,
Yeah. Yeah, we
what can
want
I
to
do?
react, right? Like whenever we hear something, you want to react by like, oh my God, I need to like send this to someone, or
Yeah,
what is this going to mean for me? And I think, yeah, you're right. Just be more mindful of what we're taking in. One of the
exactly.
things that I like is I've started sending articles to my Kindle, and
Oh,
I just, spend maybe a half an hour reading just articles on my Kindle. So I'm not like on the computer sending things, or I'm looking other things up. It's just focused, just kind of just this hour I'm going to
right.
spend on this. And then, you go back to everything else in reality.
Yeah, and that's a really good practice to have. I've been trying to do that too. I mean, I'm going to be honest, I usually avoid the news like it's a coronavirus, right?
Yeah.
Um,
Yeah.
but I will, but recently, obviously, we have to stay a little bit more informed right now. And so I've been limiting myself to 2 hours a day on information. And 2 hours is a lot, right?
Yeah.
It's actually a lot of time spent on current events. I mean, like I said before, it was none. So,
Yeah.
um, so I just, very much like chunk it into 1 hour of like, I will watch some of the DeWine briefings, and if I don't get to it, then I'll like read the transcript or whatever, that like pretty much the summary of what happened. And then looking at those sources like Vox is probably one of my favorites. And then just being mindful though, instead of, I think one of the things you mentioned is we want to react and send it to people. I think that's a really good point, because I don't know about you, but I know my parents love sharing things on WhatsApp.
Oh yeah.
And it's like immediate. It's WhatsApp viral is a thing.
Yeah. Oh yeah. I mean, that's where I get most of my fake news from, is like
Right.
WhatsApp friend or family like messages.
Yeah. So my parents are always sending things that other people send them, and I'm like, this is inaccurate. What? No, and I have to like break it down for them. And so just being mindful of that information and allowing yourself to process it before you hit send, because it might not be legitimate.
Yeah, I mean, so the reality is we want to share everything that we read because we think it's the best, right? And so I've made it a rule that I shouldn't be sharing more than one thing with people a day, because if I'm sharing more than that, then one, I think that I know more than other people, right? Or two, like this is just overwhelming for me and other people, and how can I verify all this information? So yeah,
Yeah.
I agree with you totally.
I like that. Yeah, I feel like if I see something on Instagram or Facebook, I always save it for, like you said, for that time when I'm actually going to read these things, and then I'll see if it's actually worth even liking, right? I'm not going to just like something unless it's legitimate, or sharing then as well. So yeah, I think that's really important.
Yeah.
Okay, so moving on, I wanted to talk about a little bit about vitamin C. So, within our naturopathic community, there's been a lot of research, and we've used higher doses of vitamin C for immune support, for cancer therapies, kidney disease, things like that, and it's been very supportive. And so, right now, this doctor who I just interviewed right before you, actually, his name is Dr. Paul Anderson. He's done a lot of translating of the research on vitamin C and COVID in China. And so I was curious on if you had any thoughts on that right now, or what are your thoughts?
Yeah, it's a large topic, and I'll preface this with a caveat that I'm neither an expert in COVID or vitamin C. I did have some time to look into a few of the studies. So what I'll like the 50,000 summary foot view that I have is point one, vitamin C is a very well tolerated substance, very limited side effects. At high doses, you can have, diarrhea, upset stomach, ulceration, things like that, which are relatively well tolerated. Point two, the evidence for vitamin C is very, very mixed in general. There's positive studies, there's negative studies, there's neutral studies, and they're very kind of what we call heterogeneous, or there's just studies for multiple different applications. Um, so a couple of the studies, there's a person, Hamila, who I believe is in UK, has published at least 3 or 4 different articles. And we can go into a little bit of data, but that's kind of my initial thoughts as regarding vitamin C.
Okay.
Yeah.
Okay. Yeah, I think, well, first of all, I want to mention that I'm going to say that no one is an expert in COVID right now because it is so new. No one knows anything. I mean, we can extrapolate the research from other viruses that are similar and things like that, but really no one actually knows what's happening, and we're all still trying to figure it out. So yeah, even Dr. Anderson, he talks about that too. Like, we don't actually know for sure, but what we do know, like you said, it has limited side effects and can support your immune system, and that's a big part of what you need to fight off viral infections. And so that's kind of it. But yeah, I appreciate your opinion on that. But okay, so was there anything else that we may have missed that you would like for our listeners to know?
Yeah, we can talk briefly about those studies if you'd like.
Oh yeah,
Yeah,
sorry.
yeah, not a problem.
Yeah, let's talk about it.
So there's a couple. I guess we could start with like preventative studies. And
Okay.
so there's a 20, I believe it was like 1990 something or 20, early 2000s. Hamila et al. The article that I have is called "Vitamin C Intake with Susceptibility to the Common Cold." It was in the British Journal of Nutrition, and it essentially looked at 6 studies. It was like a meta-analysis, which combines multiple studies, and it showed that there's no, based on those kind of that population in the UK, there's no reduced incidence of the common cold. So if people take it kind of over time, kind of as a preventative medication on a daily basis, there's no reduced incidence. But 4 of those studies did show that there was a reduced kind of incidence or outcome of kids, adolescent kids, males, having the common cold. And there was, about a 0.7% reduction in that happening. So that study showed that maybe there was some prevention, and then there was a larger kind of.
Sorry, before you move on, do you know the dosages that they were using of the vitamin C?
So it was variable between all the different
Okay.
studies. So I don't have. I guess I could pull it up, but I don't have the exact numbers.
Okay, that's okay. Yeah, just because I do think that is significant when talking about vitamin C, and so something to consider as well.
Yeah, absolutely. High dose vitamin C is different from
Right.
low dose. So,
Right.
and then there was a second article which was over 5 years. This one was in 2011, Eurojournal of Nutrition by Suzuki et al. And so they did a 5-year study where they gave participants either low dose vitamin C, which is 50 milligrams, or 500 milligrams over 5 years, and they looked at the one, whether or not they were more likely to get a cold or not, and then 2, how severe were their symptoms. Again, this is relatively lower dose still, but the lower dose group was more likely to get cold compared to the higher dose group, and they're about a third more likely to. There was no in their outcomes, and I didn't look kind of exactly into all the severity outcomes, but the severity was about the same in both of those groups. So those two this kind of pulls the point that there's differences between even those 2 articles in prevention.
Right.
And so it's hard to draw a conclusion, unfortunately. And then I think Dr. Anderson was referring to one of the trials with Hamila et al. From mechanical ventilation was reduced with vitamin
Yes.
C, which would be fantastic. And so I didn't get a ton of time to look through this, but what I will point out is 2 out of the 9 trials that were in the meta-analysis were for sepsis, versus I think there's 1 for burns. One of the trials was for burns, and a couple were for cardiac outcomes. And out of the 2 that were for sepsis, one of them did show benefit, one of them didn't. So again, just kind of a mix of data, and there may be some benefit for pulling people off of mechanical ventilation if you use vitamin C. So I guess my kind of conclusion from that is, again, is there harm to high dose vitamin C? Nothing that we've learned so far. Is there benefit? Potentially. And so based on that, people can make their decision on whether or not to use it in the ICU.
Yeah, definitely. And I think, I'm going to kind of bring in the doses again too, just because, like you said, the doses for low dose, they use 50 milligrams, I think, and then 500 for higher dose,
Hmm.
right?
Hmm.
So what, from my understanding, what was studied, and then also what I do in my own practice, is we do like 1,000 milligrams to even 50,000 and 75,000 milligrams. So that is for more extreme situations, of course. So with my patients with cancer, we'll do like anywhere from 30 to 50,000, sometimes 75. I personally have never gone up to 75,000, but I know other practitioners who have.
Hmm.
But it's um, but it's in a different way that we're approaching it with sepsis and with COVID. The idea is to have it, since you're in the hospital anyway, having it drip slowly throughout the day. And the idea behind it was really more so the fact that we don't produce vitamin C on our own. Our bodies don't produce it, and we have to take it exogenously, ideally through our foods for preventative health, right? And so eating our dark leafy greens and things like that, ideally from our food to get at least a minimal amount. But then if we are feeling sick and there's an increase in reactive oxygen species, then if we take an external source of vitamin C, it can help the antioxidant part of it too. Um, so, I mean, personally, right now, you don't necessarily have to agree or whatever, but right now, personally, I'm taking like 4 to 5 grams a day. Um, and from, like you said, usually the side effects are like loose stools or diarrhea or some minor side effects. And so the way we usually dose it is if you start getting loose stools, then cut back your dose, because that means you don't need that much. But yeah, so I appreciate your thoughts on that. Did you have any other comments on what I just said?
Yeah, I mean, yeah,
Yeah.
I agree. It's in medicine with anything, it's risk versus benefit, right? And so personally, I haven't used, my partner loves using vitamin C. And so personally, I don't have any like reasons not to use it. Again, it kind of goes back to all the claims with like hydroxychloroquine, and I'm like, I'm hopeful that this is beneficial, and it looks like it is. Same thing with vitamin C. I'm hopeful that it's beneficial, and it looks like it is. I just am cautious to recommending it to patients unless I see hard data, kind of
Mhm.
pushing. That's kind of equivocal, right? So that's like the
Right.
skeptic in me with everything.
Which you
So
should be. We all should be. The way I always see it is that we should be open-minded skeptics, right? Staying open-minded, but always questioning everything. And I think that's fair, and I think that's how we all should be.
yeah, yeah.
Yeah.
And one more trial that I want to talk about, which I think
Yeah.
this one's interesting. So this one is actually, have you heard of the Citrus Alley trial? It was published in JAMA uh,
When was that published?
in October of last year of
Oh,
2019.
no.
So this was actually interesting. This fits like exactly the criteria of what we look for in COVID and kind of ARDS. So when it was published last year, I did read it, and then I kind of forgot about it until we were going to have this conversation. So it took about 167 patients with sepsis, which is kind of total system failure in the body,
Right.
who had ARDS, again, acute respiratory distress syndrome. And it randomized them. So it took half the patients and put them in one population, half in the other population. And it measured a couple things. So one was their SOFA score, which is kind of an outcome measure of if critically ill patients, how they're doing. And then they measured multiple other outcomes, including whether or not they spend more time on the ventilator versus less, the number of days they're in the ICU, and then mortality as well. So there was really, really mixed results from this, which I found
Mm.
kind of interesting. So that score that I talked about did not change between the two groups. And this was high dose vitamin C. So I think they used 50 mg per kg, for 50 milligrams per kilogram,
Okay.
very high dose IV.
Yeah, that is.
And so the group, there was no change in that score, which is usually
Okay.
used for sepsis, and no change in mechanical ventilation days, but there was a difference in the number of ICU days. And then there was also some mortality benefit in the group that used vitamin C.
Hmm.
And so when it was published, it gained attention for being a negative study, not having much benefit. But looking back at the data, perhaps there is some benefit in reducing ICU stay and mortality. It's just hard, given the nature of how things are changing, to draw a conclusion one way or another. So I didn't mean to like inundate everyone with multiple different studies, but I just want to point that there's so many different results going both ways that it's hard to draw a conclusion.
And that is, I mean, I guess the downside or the complications with research in general.
Mm-hmm.
This is why it takes so long to actually get it into clinical practice, is because we need to do thousands of studies in order to get into clinical practice. And but yeah, I think a lot of it goes down to the risk benefit ratio. So if there's very little risk, I mean, in my perspective, if there's very little risk, why not try it? And that's usually the way I think about it. I'm like, okay, if there's a risk, obviously, then we need to be more mindful. But if there isn't really much of one, why not?
Mm-hmm.
But okay, well, I am going to wrap things up. Yeah, was there anything else that you'd like to add aside from the vitamin C? I actually really appreciate you going through the research studies. That was really cool and really helpful. So thank you.
Yeah, not a problem. No, I think I'll just end by saying, regarding COVID, I think it's I've kind of made it a mission within my family and friend circle to say, like, it's our responsibility as humans just to stay at home, avoid going out. Now wearing a mask, the CDC recommends everyone should wear a mask, not to protect yourself, but to prevent spreading it to other people. And I think that's one of our responsibilities as humans now, is to do our job in keeping ourselves healthy and preventing the spread, because you're not going to harm yourself if you're relatively healthy. You can still get sick, but you're going to harm other people. And so I'll kind of end by saying that that's the number one thing we should be doing.
Right. I agree. Yeah. As we're both socially distancing ourselves, I think that's really important right now, and we all need to do our part. And if all we need to do right now is stay home, I think that we'll make it through.
Exactly. It could be worse.
It could be worse. It could be worse. Yeah. And thankfully we can still go outside.
That's right. Yeah.
Yeah. Especially in Ohio. I don't know much about New York. Might be a different situation. San Francisco, the bigger cities, a little bit more complex. So I'm grateful that in Ohio we have a little bit more space and we can still go outside.
Yeah. Backyards come into use now.
Yes. All right. Well, thank you so much. Is there a place that people can find you in terms of like social media or something, where if they're trying to reach out to you?
Yeah, absolutely. I'm on Twitter. My Twitter account's at Medical Tech Doctor, or Medical Tech Doc. Sorry, MEDICAL Tech DOC.
Okay. Yeah. Okay. Cool. Yeah, I'll put that in the show notes too. So we'll have all that. All right. Well, thank you so much, Dr. Patel.
Not a problem. I enjoyed being on here. Thanks, Dr. Patel.
Thanks. I hope you all enjoyed that episode and now have a better understanding of how to decipher whether information is legitimate and reliable or not. And I hope you are better able to understand how the research can also be tricky. So nothing is really that simple. Nothing is black and white. I will have Dr. Patel's information and the resources we mentioned in the show notes below, so make sure to check that out. But that is all I got for you all today. Be sure to stay tuned for what call to actions we put out there to support our healthcare providers during this time. But for now, let's all do our part and physically distance ourselves from one another while staying connected wirelessly. Wishing you all Mahan health, and I will see you next time.